Answering this question about blood thinners, anticoagulants in pregnancy, specifically heparin and Lovenox. How do we do a risk analysis with these patients and decide whether it's safe to place an epidural for labor? Most anesthesiologists follow the guidelines we have from ASRA, the American Society for Regional Anesthesia. The latest were published in 2025. Because the bleeding complication we're looking to avoid with this is so rare, it's not something that we can evaluate with large randomized control trials. So instead, these guidelines are mostly based on what we know about the pharmacology of the medications, how long they last, and they're considered to be conservative, safety first. So these are appropriate to use for something like a labor epidural, which is not an emergent situation. What we need to know from the patient is what medication you're taking, what the dose was, and when it was last administered. Anyone who's been on heparin or Lovenox for more than 4 days also needs to have a CBC to confirm a normal platelet count. I'll just go through the recommendations quickly. First, for heparin, low dose is 5,000 units twice a day or 3 times a day. For those doses, the recommendation is to wait at least 4 to 6 hours since the last dose. Alternatively, you could confirm a normal PTT or an undetectable anti-10A level. High-dose heparin is split into 2 categories. The first is less than 20,000 units per day, so that might look like 7,500 units twice a day. The suggestion for those doses is to wait at least 12 hours, and you have to confirm a normal PTT or an undetectable anti-10A level. The second category is a dose of more than 20,000 units a day, and the suggestion here is to wait at least 24 hours plus confirm that normal PTT or undetectable anti-10A level. For Lovenox, which is enoxaparin, again, there is a low dose, high dose distinction. Low dose would be 40 milligrams once a day or 30 milligrams twice a day. And the recommendation is to wait at least 12 hours before needle placement. High dose Lovenox would be either 1 milligram per kilogram twice a day or 1.5 milligrams per kilogram once a day. And in those cases, we need to wait a full 24 hours.